Welcome to the Care Forward Innovations podcast with Bernadette Viñas, proudly sponsored by Care Forward AI, where we build AI-driven solutions that help elevate care. Care Forward Innovations is a space for fresh ideas, honest conversations, and real-world stories from the people working every day to improve senior care, home care, and support for older adults and their families. In this episode, inspired by leaders like Stephanie, we're talking about what great care really looks like behind the scenes. Not just the services being delivered, but the people, communication, and support systems that make compassionate care possible. We believe the future of care should still feel deeply human. Innovation should make care easier to deliver, easier to coordinate, and more supportive for caregivers, providers, and families alike. Thanks so much for being here.
Hi, everybody. Today's conversation is about care in its most human form. I'm honored to welcome my good friend Stephanie Holm to the Care Forward Innovations podcast. Stephanie is a regional manager at Serengeti Care, but more than a title, she's someone who chose senior care because she believes aging adults and their families deserve to feel seen, supported, and respected, especially during vulnerable moments. With more than 4 years of hands-on experience in home care, Stephanie understands the realities of this work from the ground up, supporting caregivers, guiding families, and navigating the daily challenges that come with delivering compassionate care at home. She leads with integrity, empathy, and a deep connection to the communities she serves. Outside of her professional role, Stephanie is active in Rotary, volunteers locally, and brings the same care and intention into her life as a mom. Today, we'll explore what it takes to protect the human side of care, how leadership shows up when systems are under pressure, and what the future of senior care needs in order to truly serve both caregivers and the people they care for. So welcome to our podcast. Stephanie, how are you?
Doing pretty well.
So great to see you, and I'm truly very excited to hear your work in the senior care industry. So you've shared that senior care isn't just a job for you. It's work you chose because of the people and the moments that matter. So can you take us back to what, first drew you into this field?
Yeah, absolutely. Like you mentioned, as a mom, we have certain responsibilities and things we're trying to teach our little ones. And about 4.5 years ago or so, picking my son up from school every day, I ask him, "How was your day? Who did you help today?" Number one question. And after a while, he started asking me the same question in return. And I realized in the job that I was doing, while it was a great job, and I really loved a lot of the people that I worked with and what I did, I never had a good answer for him. So I started really mulling on that and thinking about what I want to do, what serves me and my heart. And I love my grandparents. I've volunteered with seniors. So I began just Googling and looking on different job sites, job boards for work with seniors. I applied to a job, I interviewed, and when I went in, I didn't even know what home care was. And to my astonishment, they offered me the job. And over the last 4.5 years or so, I've just been kind of building up my career within the industry and creating a lot of really amazing community partners. And now I sit in this amazing role with a different company, but I get to help even more seniors across all of Western Washington and some of Eastern Washington as well.
That's great. I guess along the same lines, that's actually part of the reason why I also started my podcast focused on senior care. I felt like I needed to do something a little bit more that's closer to my heart. Yeah. Not that I don't enjoy my job, same thing, but I wanted to do something a little bit more where my passion kind of comes out. And exactly. I feel like the senior care industry is where it is. So as far as being a mom and being active in the community, how has it shaped the way you show up for seniors and families and caregivers?
Yeah, just like being a mom, in my current role as a regional manager, I oversee 10 different branches, and every single branch has different staff, a different market, a different socioeconomic climate, everything. And so I have to show up differently for every single person that I'm talking to. when I dip in and actually get my hands dirty, essentially, and working with the clients themselves or helping navigate a difficult situation, I'm showing up exactly as they need me to in that moment, just like I do for my now almost 9-year-old son, where every day he needs a different part of me, a different version of me, and I'm able to kind of pivot in between those things. And I think being a mom, especially to a young child, has really made this career even more fruitful for me because I'm getting to relay information, tell him stories about how I'm helping, and that resonates with him and how he can show up differently for his teachers, for his classmates, for family members. So all in all, I think that being a mom and being in this industry and this role really work and complement each other really well.
That's really nice, where you feel proud to talk about your day.
Yeah.
So what was it about Serengeti Care then that made it feel aligned with how you believe care should be delivered?
Yeah. So as I was kind of working towards transitioning to a new role and new opportunities, I was just researching different companies, and Serengeti Care jumped out at me. I did get a little push from a former colleague to look at them. But on their core values on their website, the two things that really jumped out at me of their highlighted core values was creativity and transparency. And those are two things that I think are paramount to working in any industry, but in senior care, in home care specifically, being really communicative and being really honest, focusing on not over-promising and under-delivering, and then also finding the yes in most situations. Not all things are doable, but for the most part, being creative and encouraging creative solutions amongst my teams are really important to me. And so when I saw those on their website, on the Serengeti website, I thought, okay, they're thinking along the same lines as I am. And then I had the opportunity to speak with the owner, Albert, and he just blew me away with his compassion and his heart. You could hear it in his voice. And I walked away from that call and thought, I don't care if I get the job, but I have to work with this company. I have to work with this owner. And it is a family-owned business, which I think is lovely. It's him and his wife, and they lead from the top with heart and with compassion through everything that they do.
Yeah, so it sounds like that Serengeti emphasizes relationship-based and personalized care, right?
Absolutely.
So from your role as a regional manager, how does that philosophy show up in everyday decisions that you make?
Yeah. One of the great things about being a relationship-based company, having that as such a huge part of our core, is that I'm really encouraging my teams, my branches, to not just get out there and market, get out there and get our name out there, but actually form relationships with referring partners as well as with our competitors. There are times when we're not the best answer for a client, or when we can't necessarily hire a specific caregiver for whatever reasons. I really take a lot of pride and value in encouraging my teams to contact a competitor and say, hey, we have the same goal. We have the same mission to serve our community, to serve our seniors and our less fortunate, our most vulnerable populations. Can you help? We can't, for whatever reasons we have, whatever barriers we have, we still feel like we can call on any competitor and say, can you help? And I know it's maybe bad for business, but at the end of the day, that person is going to get helped one way or the other. And we may not be getting the revenue from that, but I'm happy to call on competitors and vice versa. I get calls from folks who say, hey, we tried and we had a failure in communication or whatever it is. Can you try? Absolutely. We're going to do our best as well. And that's encouraged from Albert and from everybody within the company to just try to always do the right thing by whomever it is we're working with.
Yeah, that's very sweet and sounds very genuine. So that's definitely sounds very different to me and makes Serengeti Care sticks out. So that's really great. How does Serengeti focus on community connection, like changing the experience for seniors and families?
Yeah. Well, like I was saying about getting out there into the community and doing that marketing piece, we're also really encouraging our managers and our staff to do as much as we can just on a volunteer basis during the workday. So not on their own time necessarily, but we've been working a lot with the local VFWs and different veterans affairs for our unhoused veterans, for those who are at risk of becoming unhoused or losing benefits. And so even though we may not acquire any clients from that, we're using a large part of our marketing budget to actually provide meals, provide when they have large lunches, provide a portion of that. We have donation bins set up throughout the community that we're collecting and taking to the different VFWs. And that's kind of an initiative that we're pushing through well beyond the Veterans Day holiday. And so it's just a lot of that. It's a lot of, yes, we want to get our name out there, and yes, we want to help, and yes, we want our business to grow, but also how can we do that but do the right thing by a lot of different people? And it's been amazing. And just the pride that my teams feel when they come back from an event and they send me pictures and say, look at all these amazing people we worked with. And my question isn't, well, how much business did you get from that? It's more just, wow, that's incredible. We made a difference on that day. And with the support of Serengeti and our budgets that we're allowed to use. But I think it's making a huge difference in our communities.
So have you received some feedback from families or the senior citizens themselves as far as the type of support that they receive?
Yeah, absolutely. We get reviews all the time, online, through phone calls. The best compliments, the best ones that I've been getting lately are just my team's ability to be accessible, to answer their phones. One of the things that sets us apart, I think, from a lot of other agencies and just a lot of people in businesses in general, is that when a client or a caregiver is calling their branch, their local office, they're actually calling that branch manager's cell phone. They have it with them all the time. There's no third party or disembodied voice somewhere else. It's literally you're calling that person. And if for some reason they can't get to it, they have the ability to immediately say, hey, thank you so much. I saw your call. I'm going to call you back in 20 minutes or whatever the case may be. And then even when my managers or my teams need to take some time off, which they deserve, they just roll their phone to me. So my work phone is always with me. And if it rings, it's usually a client or caregiver from one of my branches. And we're all able to just kind of pitch in and help. But we take having that phone with us and having that phone on and ready to go really seriously. And it's made a huge impact on our client satisfaction and our caregiver retention and satisfaction as well.
Yeah, it sounds like that's the personalized care that is a very important quality that you guys provide for the community.
Yeah, exactly.
Yeah, it's so much. It's so refreshing because to me, we've definitely heard some negative experiences from different senior care facilities. So it's very nice to hear the positive side. So to deliver that level of personalized and reliable care, what kind of behind the scenes work is required from your team?
Oh, the list is endless. I mean, we're constantly working together as a team, as a region, all of my branches and myself, just trying to innovate and make things easier on ourselves, on each other. But there's also, we have an amazing home office team of HR specialists and billing and payroll and all of those people who really come together to try to make the branches' lives as easy as possible so they can do the work. And I travel from branch to branch and help where I can, and I'm always available. So my one day never looks the same because all it is getting somebody has a question or an issue, and I'm able to, from my home office, help problem solve, take the burden off, make a couple calls for them. And that goes across the board. Anyone within the company is able to just jump in and help. So those day-to-day office activities can be done efficiently and with the same heart and intention that they need to be.
Nice. So actually going back, tell us a little bit more about the services that Serengeti Care provides, because different communities provide different services, right?
Yeah. So primarily we are home care, which is generally non-medical. It would be things like bathing assistance, transferring assistance, ambulation, grocery shopping, housekeeping, meal prep, things like that. We do have some contracted nurses on staff, and we do have caregivers who can be delegated. So if it is a nurse task Many tasks can be delegated to a caregiver, such as diabetes care, foot care, wound care, things like that. We also have other initiatives and programs behind the scenes, including a foundation that we just started, which is a charity for caregivers, not just Serengeti caregivers, but any caregiver at any agency can contact us and apply for a financial grant during a time of hardship, which is really cool because, especially right now, things are tough and a caregiver can work full time and still be struggling. So this is a really neat program on the back end that's hopefully going to make an impact.
So how many locations total do you have in, let's say, Washington State to start?
Washington, so I oversee 10. I should know the answer to that, but it's somewhere in the mid-20s total between Washington, Oregon, Idaho, and Montana.
Wow, that's a lot. It's pretty big. So that's great. That means you guys are doing really good work, and you've been able to spread out and provide more care to different communities.
Yeah.
How long has Serengeti been around?
We were founded in 2016.
Okay. Wow. And it has expanded that much.
Yeah.
That's nice. Where do caregivers or care coordinators spend time that families rarely see, but that's essential to maintaining the quality of care?
Yeah, honestly, in their office, at their desk, is a lot of the time is there just navigating the logistics, and then also in the field, meeting clients, delivering gloves, delivering supplies that people might need, doing check-ins, spot checks. We like to be in the homes with the caregivers. We always do a warm introduction handoff to when we start a new client, we bring the new caregiver in, and that branch manager is there to introduce them. All of our staff are also certified to provide care. So in the event that a caregiver calls out sick and we don't have anyone to go, somebody in the office can go. So we do our absolute best to make sure no one goes without. And that's also a unique characteristic of quality of Serengeti as well.
Nice. So people step in personally to make sure nothing falls through the cracks, in a sense.
Exactly.
So somebody's always going to be there. That's nice. How often does care quality rely on memory, follow-ups, or individual efforts rather than on repeatable processes?
So every single caregiver has an app on their phone, and that's how they know what the tasks they're supposed to accomplish while they're there. And those tasks are individualized, specialized based on the individual we're providing care for. And then beyond that, the office staff, we have reminders and ticklers and apps and platforms to help us stay on top of their licenses, their insurances, make sure that they're, crossing all their T's and dotting all their I's on every single shift. And then also coming into the home and checking on both the caregiver at work and the client. So we have all of these little layers within our systems to remind us to stay on top of those things as well. Everything follows technology and apps at this point.
Do you feel that the providers have any pain points when it comes to that?
Yeah, technology isn't easy for everybody. So during our orientation and onboarding of a new caregiver, we are reviewing the app, showing them how to use it, practicing with them. But that doesn't always mean it's going to be easy. So sometimes we notice somebody is having a hiccup over and over. And so somebody from the office will come out while they're on shift and do some things with them on the app to make sure that they're able to navigate and complete the tasks properly within the legal aspects that we need to have things done. We do have, with Serengeti, we do work with Medicaid, the VA, and long-term care insurance, as well as a private pay. And they all have different rules that we have to adhere to make sure that we're staying compliant. So we take it serious.
Yeah. So are they needing to bridge any gaps at all to protect the client and the family experience?
In what, through the technology piece?
Yeah, for anything. I mean, technology or processes that needs to be added into the day-to-day.
Yeah, we're always adding improvements, sometimes too many at one time, it seems like, to just improve those systems and use newer apps, new platforms that are making things easier and easier. So we're in the process of transitioning to a more robust app, which will help eliminate the need for massive paper binders and handwriting things on every single shift. Everything will be right there and within HIPAA compliance and all of those things. So that's going to be a big turning point for Serengeti and for the efficiencies of the caregivers and the office staff. But all that's come from constant trial and error and getting feedback from caregivers in the field, getting feedback from families on how things are going from their perspective, and then just having the home office do the hard work.
So it sounds like technology at least is helping them be able to do their day-to-day.
Absolutely.
So as Serengeti continues to grow, what parts of your care model are non-negotiable to preserve?
Yeah. So one of the reasons I was so eager after speaking with Albert, our owner, is that this being a family-owned business and run as lean as possible, as in-house as possible, is a top priority. So there's nowhere on the foreseeable future of outsourcing any piece of our business aside from using technology and apps where we're able to, keeping our branch manager and our staffing coordinators in the office, being the front line, doing the communication. If we have to add more staff to any location to make that sustainable for as we grow, that's what we're going to do. And we're going to find a way to make that sustainable and scalable for the long term.
So do you know about how many, staff per location on average? Or
on average right now,
depend?
it depends on the size and the amount of clients and caregivers, but on average, we're sitting between 2 and 3 individuals in the branch doing the daily operations.
Right. So overall, how many employees are with Serengeti then?
I love that question. I don't know the answer to that.
Okay.
I can get that for you. Some sort of calculation could be done, and if I was more prepared, I'd have it for you.
Yeah, it's all good. I was just curious personally. So as you get more senior and families to serve, what becomes harder while maintaining the same level of personalization?
Yeah, the sheer number of people in the office. If it doesn't go up with the number of clients and people we're bringing on, our communication will get worse. And so that's why we're really monitoring how many new clients we have, how much are we actually serving? And we have a metrics for that, for when to add more staff as we grow. So the biggest thing that will be hindered in that experience is communication. But I think because we're all really in tune with that, we're going to keep a really close eye on that trajectory for every single branch.
So do you find it easy to find people to fill in the need to have more staff in each location?
Yeah, there's no shortage of applicants for an admin staff. Every time we have an opening, we're interviewing dozens of people. And caregivers, we have so many applicants of caregivers. Most caregivers work for multiple agencies. So if they're not quite getting what they need from hours-wise, income-wise from one, they might try to work for a second or even a third. And that's just the name of the game. So we get applicants, and when they come in, they might say, well, I already have another job and I'm just looking to find shifts on these days that I don't currently have hours. And that's great. We're going to look at our schedule, or we're going to work with you. We're going to look out and try to find clients within the time frame that a caregiver is looking to work. But there's never a shortage in people wanting to get into this field, which is really amazing, honestly, because it's caregiving is the hardest job on the planet. So it's pretty amazing.
Yeah, definitely. It takes a toll in the heart and mind, especially because unfortunately we lose the customers, right? We lose the seniors. But that's interesting because in some other cities that I've had interviews with, they do sometimes have a hard time finding, resources. But maybe in our area over here, it's not as hard. Do you know on average how many like customers you guys have?
How many actual clients we have?
Yeah.
I don't have that number from my branches. I have a brand new branch that just got their first client. And then I have a really large branch that has about 150 clients. So anywhere in that realm is what we're working with here within my region, at least.
So for that one branch that has about 150 clients, how many providers do you have that?
We have about 175 caregivers assigned to that branch. And then within the office itself, we have 4 admin staff. So.
Wow. Okay. That is a lot bigger than I was thinking, but that's great that you're able to fulfill that. So what kind of systems or processes best support your caregivers so that they can focus on the people and not paperwork?
Yeah. So having the app with the actual care plan, through that app, there's also the GPS so they can get to the house. It's all within HIPAA compliant, so they're not needing to use their personal GPS to type in people's addresses and things like that. And then through there, they can also communicate with their branch just through messaging. So if they're in the middle of something or they don't want to interrupt a client who might be resting, they can just send us a quick message and say, hey, I have this question about their home, or I have a concern about their current status, that kind of thing. And that really helps the caregivers stay totally engaged. They can just check off the things that they're doing, the necessary tasks that they're doing, communicate with us, and also leave us notes about the shift right there in the app. And then they clock out with GPS when they leave. So it takes a lot of that writing down. There's no manual punching in or anything like that.
That's nice. I don't think everybody probably has access to that app. So I wonder, was it customized for Serengeti, or is it actually something that's publicly available? Really?
Yeah, so there are a lot of different apps and platforms. The one that we are currently transitioning to is a massive, and it's very highly used amongst the larger agencies for sure. And even some of the smaller ones are using it. So it's nationwide. So it's becoming more and more mainstream to utilize apps like that.
Is it AI like assisted as well?
That may be a feature within it. We aren't utilizing any AI for our scheduling or our communications. Right now, we're trying to keep it as human-centered as possible for a lot of reasons that we've kind of already talked about.
Yeah. So as a closing thing, if caregivers had more time, clarity, and support, how would that change the experience for seniors and their families? Or do you find that with your team that they are able to spend in as much time as needed by the seniors?
Yeah, I think that with the proper app and the proper training on how to use the tools, we're finding that the caregivers are able to really be fully engaged in the human being that they're working with. Sometimes we get reviews or we get feedback from a family that says that caregiver was not attentive or was on their phone too much or was whatever the issue may be. Usually it's resolved with training, with coaching. And sometimes it is coming back to the family and saying they have to be on their phone part of the time to communicate with us and to document. But as long as the caregivers know we are fully invested in their success, in their comfort, they typically are doing this job for a reason and their hearts are in it. So with quality coaching, quality support, and showing up for our caregivers, we find that they are far more invested and engaged.
Do you feel that there's anything that needs to be better when it comes to senior care?
I think the list could go on forever.
Or what's one that really sticks out?
One of the primary things for me, just off the top of my head, is that there's not enough. Like I said, we send clients to competitors all the time. There's so much need and there's not enough people out there to do it. There's not enough companies. And the funding for senior care, the funding for low-income senior care, for care for individuals with disabilities, for our veterans, there's just not enough. And a lot of agencies don't have contracts with the VA or with the state. And so the options are a lot more limited. So if I could wave a magic wand and magically there would be unlimited funding to care for our most vulnerable seniors. And we also serve individuals with DDA services. We have children as young as 4 and 5 that we serve as well. There's just never seems to be enough funding.
Yeah, because I know that senior care can get pretty expensive. But I mean, for your organization, you probably don't see it in the same way because you don't have facilities or communities that you actually house. But the average cost for senior living is so high. I mean, it's even higher than regular rent at this point, which I suppose kind of makes sense if they are actually getting assistance. So, but yeah. So, but what gives you hope about the future of senior care and the role organizations like Serengeti can play in shaping it?
I think the thing that gives me hope, the reason why I love doing this is that every single day I hear a new story from an employee or a teammate in one of my branches about a way that a caregiver or the admin staff themselves made a huge difference in someone's life. Just even if it's just for that one day, but the more we tell those stories and the more we celebrate that success, that one teeny tiny success, it just reinvigorates everyone. And the more we can share that love with our communities, the more people want to help and want to be a part of it.
Let's see. Any other thoughts that you want to talk about or say to other senior leaders?
I just keep doing the work you're doing, whether or not you're with Serengeti or a competitor or an advisory firm or whomever. Like, we all need to work together, and together we're going to take care of our people. So.
Yeah. And I'm learning that people are actually living longer than before. I guess that can be contributed to the kind of health care that we have nowadays, like how much we pay attention to our health and the care for what we eat and what we do, exercises and stuff. So I think that is also contributing to that. But I'm also learning that the population of senior adults is also getting bigger compared to what it was before. So it's very interesting.
And quality home care will do that. We'll keep people out of the hospital. We'll help them, eat better, do their exercises, and just companionship alone. Having somebody to talk to goes a really long way for longevity in life and for fulfillment.
Yeah.
That's a huge part of home care.
Yeah, and the trend is that more people are wanting to be able to stay at home. That's probably why your organization has been more successful, is because you provide that in-home care rather than having a facility or community that people go to. Well, I thank you very much for your time, Stephanie. I appreciate it. And I look forward to hearing more about your work and see how well you guys grow.
Absolutely. Well, I appreciate the time and happy to talk anytime. I could talk about this forever.
That's good. Well, you have a good rest of your day.
All right. Thanks. You too. Talk to you later.
Okay. Take care. Bye-bye.
Thank you for listening to Care Forward Innovations. We hope today's episode gave you fresh perspective, practical ideas, and encouragement for the work of improving senior care. Every meaningful change starts with one conversation, one insight, and one step forward. Be sure to follow along for more episodes featuring leaders, lessons learned, and real-world solutions helping move care forward.